Next is lung Qi deficiency. Lung Qi deficiency can arise independently, but will most often be seen together with spleen Qi deficiency or heart Qi deficiency. When there is lung and spleen Qi deficiency, there will be a general condition of Qi deficiency characterized by poor production of Qi, whereas lung and heart Qi deficiency will be a more emotional imbalance with sorrow, grief, and a lack of joy as the dominant symptoms. Concept, this is due to a declining function of the lung in governing Qi and dominating the weight defensive function. Key symptoms, weak cough, dyspnea, low voice, and clear watery sputum with other symptoms of Qi deficiency. Clinical manifestations, weak cough and dyspnea, shortage of Qi, shortage of breath, which is worse on exertion, clear watery sputum, low voice, spontaneous sweating, aversion to wind, a tendency to catch cold, mental fatigue, tiredness, pale complexion, pale tongue with a white coating, and a weak pulse. This pattern is mainly caused by chronic cough, damaging the lung Qi, or spleen deficiency unable to transform sufficient food into essence Qi for nourishing the lung. Lung Qi deficiency can be caused by a respiratory illness in childhood. Poor posture, where the person sits slumped forwards, can inhibit the Qi mechanism of the lung and thereby weaken lung Qi over time. Furthermore, a lack of exercise will mean that the Qi mechanism in the upper jaw is not supported by physical movement. Lung Qi can be weakened by repeated invasions of exogenous pathogenic Qi, or if there has been an invasion of exogenous pathogenic Qi that has not been properly resolved, for example, through the use of antibiotics. The lung is emotionally affected by grief, sorrow, and melancholy. If the person has experienced repeated or excessive grief and sorrow, especially if the grief remains unresolved, it will bind and weaken lung Qi. Lung Qi is weakened by excessive talking or singing. This is because Zong Qi is used to create the volume of the voice. This means that teachers, lecturers, actors, and singers can have a tendency to develop lung Qi deficiency. Excessive consumption of spicy food can spread and expel lung Qi through the pores in the skin. Lung Qi can be an aspect of other Qi deficiency patterns, and therefore their etiology can also be involved in the generation of lung Qi deficiency. So the etiology of lung Qi deficiency would be hereditary weakness, poor posture, which constricts the breath, exposure to cold, prolonged grief and sadness, weakening the lung Qi, repeated impairment of lung Qi diffusing and descending over long time. Signs and symptoms, shortness of breath, panting, worse on exertion, forceless cough with profuse watery sputum, weak voice, spontaneous daytime sweating, dislike of speaking, pale or bright white complexion, easily catches colds, tiredness, dislike of cold, feeling of cold, cold hands, cold feeling of upper back, absence of thirst. The pulse is weak, especially the right front position. Tongue is pale, slightly wet, white coating. Treatment principles: strengthen the lung Qi, support defensive exterior. Acupuncture treatment: lung 9 to supplement lung yang, Ren 6 to supplement original Qi, fortify yang, Du 12 to relieve cough and dyspnea, Ren 12 to supplement earth to strengthen metal, Bladder 20 to supplement the spleen, Lung 7 to promote the descending of lung Qi, Bladder 13 to supplement lung Qi, Stomach 36 to supplement stomach and lung Qi, Bladder 43 to supplement the lung, and Spleen 3, the source point of the spleen. We needle with supplementation and use moxa if required. Because this is a Qi deficiency condition, the advice given for spleen Qi deficiency and kidney Qi deficiency will also apply here. That is, the person should eat a diet that is nutritious but does not weaken the spleen. Food that is white in color will often have an affinity with the lung and can be used to focus Qi tonics on the lung. The person should avoid consuming food that is very spicy because it will spread and thereby weaken lung Qi. Foods that particularly strengthen lung Qi are turnips, daikon, radishes, parsnips, parsley, onion, garlic, tofu, herring, walnuts, almonds, cauliflower, dates, figs, duck, tuna, grapes, thyme, and ginseng. Ginger tea will also be beneficial. It is important that a person who is lung qi deficient does not strain their voice because it will weaken the lung qi. A person with lung qi deficiency must ensure that they get enough rest and do not overexert themselves. However, light exercise and movement will be beneficial because they will open the chest and support the lungs' qi mechanism. Going for walks in fresh air will be salutary because the person will get some light exercise and the fresh air will nourish the lung. Yoga and Qigong often utilize breathing exercises that have a beneficial effect on lung qi. It is important that a person who is lung qi deficient is conscious of their posture because a slouched, slumped posture and sunken chest will strain lung qi. If there is an emotional aspect to the lung qi deficiency, the person should try to resolve these issues.